Hi, Dr. Brian Koffman, the Chief Medical Officer, Executive Vice President, and the co-founder of the nonprofit CLL Society, and a retired family doctor and CLL patient myself. And I'm going to be talking today about one of the papers that was presented at the American Society of Hematology's annual meeting and exposition that was held in December of 2021 in Atlanta, Georgia, and virtually. This is often shortened to ASH 2021. And this paper dealt with the uptake of novel agents as first-line treatment for Black and white patients with chronic lymphocytic leukemia in the Veterans Health Administration. It was a retrospective cohort study. We all know that since the introduction of novel agents in 2013, the treatment paradigm for chronic lymphocytic leukemia, small lymphocytic lymphoma, has changed significantly with the uptake of novel agents in first-line and refractory CLL. And we've seen great improvements in survival outcome in CLL, but Black patients with CLL have demonstrated inferior overall survival compared to white patients. Studies suggest there may be some difference in disease biology, but is this the whole story? Differences in disease biology and access to medical care and treatment may contribute to these racial disparities. The purpose of this study was to assess the uptake of novel agents in the Veterans Health Administration, where access to care is equal for both Blacks and white patients. It was a retrospective study done from 2014 to 2017 and used chart review to see which patients with CLL received which medications. A total of 565 patients were studied, 86% were white, 86% were white, and 14% were Black. So what we found in this study is, looking back at the early years, there was a preferential use of novel agents in white patients. For example, in 2014, the first year that we have data, 17% of the white patients received novel agents, where only 4% of the Black patients did. This began to improve, and by 2017, 33% of white patients received novel agents, and 31% received, of the Black patients received novel agents. So the numbers became much closer, and the disparity slowly diminished. But still, there was a statistical difference in the use of novel agents between Black and white patients in the Veterans Health Administration during the study period. The fact that it was improving over time gives us encouragement, but we need to understand why these things happened in the first place and what we can do to prevent this kind of disparity from reoccurring as new advances are made in the management of CLL.